Hello, my name is Katie, and this is my project proposal. And the topic I chose is the political influences on women's health. So, the two countries that I decided to focus on are going to be the United States and France. So, women's health is a very prominent topic in all news outlets that we really see today, every day of our lives. And it's due to the interfering presence of politics and government influence. So the United States, speaking, in today's world and historically speaking, has played a huge role in women's health. Um, this heavy role of involvement of government in women's health isn't seen as much in other countries, and France is a prime example of this. So, a major health issue of women's health that I'm interested in researching more, and that the government, especially here in the United States, really interferes with, is the topic of, women's reproductive health and abortions. So, I intend to research mortality rates, incidence and prevalence rates of abortions in the United States versus France, and compare that to each government's involvement and study the health of the women that have these abortions and have issues with their reproductive health relating to health outcomes then. So, specifically speaking on women's reproductive health, France has less political involvement in this topic, which also leads them to having higher health rankings than the United States, who here we have a very heavy political involvement in this topic. I plan to research more details about comparing women's reproductive health and mortality rates between these two countries. Societal factors in the United States especially makes the topic of women's reproductive health and access to abortion care taboo and not really talked about as much, whereas France keeps it very to the point and places the health of the woman at priority. I plan to research more how societal factors play into this, looking at in the United States and also in France, and how I think the United States would be able to use France as kind of a example in their ways and policies. And in the end, I do think that France will have much better health outcomes for regarding women's reproductive health, and it's going to be in due part to their governmental influence and their less involvement, and allowing women to have access to their proper reproductive health care.